After the earthquakes devastated Haiti, there was a need for functioning instruments. Instruments of Mercy had an opportunity to join Village Partners International, a surgical team determined to make a difference. Dr. Sylvia Campbell and her team of medical volunteers have been coming back to Haiti since 1995. The destination this time? The remote mountain village of Mombin Crochu. Several challenges stood between the team and helping the villagers.
The tent was for cholera patients. That was something that I did not expect. We knew there were a couple cases, but to see this massive structure with patients in there when you first get to Haiti is just, I can't tell you what kind of concern you have.
The death toll due to cholera had climbed past 1,000. Poor sanitation and crowding provided an ideal breeding ground. The team introduced new processes to stop the spread of the disease and to educate the villagers. They took a vacant operating room in a hospital built by the World Health Organization and brought it to life, as well as a dental clinic. They knew going in that every day would be a race against time, to see as many patients as possible while on the ground. Instruments and equipment had to be ready, so nurses like Maureen and her team could focus on the procedure at hand, instead of instrumentation concerns. Not everything could be repaired stateside. Sometimes they had to improvise, using whatever they could find. After they set everything up, it was time to visit the schools and churches, to let the villagers know that medical and dental help had arrived. Opening day came, and so did the needy, some having waited for years. Treating and teaching became one, each case unique. Suffering came in many forms, regardless of age. The team faced ongoing challenges as well. The question of the day, every day, would there be power and water?
We're standing here outside the water source of the hospital. Hospital opens at 8 a.m. It's 9:45. There's no water for surgery, no water for extractions, because the water's been shut off. So the people here in line to get water to do laundry, breakfast, food and things, and we're in the same boat in the hospital, just waiting for the water supply to be turned on. It's a limiting number of patients we see today because we can't do any procedures without waters to irrigate. So 9:45, no water.
They made the best of their uptime, working uninterrupted, case after case, without a break, until night fell. Every hand was welcomed. Many villagers needed oral surgery. Others received their very first toothbrush. Some walked away able to see their loved ones clearly for the first time in years.
And why do you keep coming back? She loves it.
To help. To have, we've developed friendships throughout all these years, so it's more on their minds and just being able to come back and see them and help them as much as we can.
You do a great job doing it. I'm just glad to be part of it.
I'm glad you finally got to come.
Thank you, Marie.
This is my friend from yesterday that we closed the opening up in his mouth. He looks so handsome today, all dressed up. Came to say he's feeling better, the hole's up, and said, I love you and thank you much and will pray for me. So this is the highlight of me for my trip, my friend here that we helped yesterday.
Before the team knew it, it was time to leave. On the long flight home, they recalled the faces, the spirit, wondering which lives were impacted the most. And then it hit them. The lives impacted the most were their own.
She